Welcome back to Motors and Medicine. On today's episode, I'm going to be discussing photobiomodulation, or light therapy is the easier way to understand it or explain it. So I'm going to be talking about what it is, how it works, what its applications are, and how it might benefit many of you out there. So let's start with what is it? Basically, photobiomodulation or light therapy is a controlled exposure to a spectrum of light that is in the safe spectrum for a given amount of time, and it's going to be done on average 3 to 5 times a week, or 3 to 5 sessions a week, lasting about 20 to 25 minutes each session. Now, this light therapy can consist of a multitude of lights within the safe spectrum. So greens and yellows, oranges, reds, infrared, that sort of spectrum of light, if you will. And light therapy itself has been around for quite some time. It's been utilized in many different aspects of medicine and in healing and in treating skin tissue diseases and lots of other things that it works for. But basically, I'm going to just talk about a little background on what exactly it's doing at the cellular level, and then we'll kind of discuss some uses and some implications as far as how it might benefit different conditions and different populations. So essentially, what it is every tissue in the body is comprised of cells, and within those cells you have the different compartments of the cells. And you have things like your nucleus and your endoplasmic reticulum and your mitochondria and your transport proteins and so on and so forth. Now, every cell in the body is constantly going through restructuring and regeneration, breakdown, rebuilding, and that sort of thing. And what energizes or what powers that cellular function is the mitochondria. So the mitochondria are these bean-shaped structures found within each cell of every tissue in the body. And the mitochondria act as like the batteries of the cells. They power and energize all cellular function, whether that be rebuilding, breaking down, re-energizing, whatever it is that the cells are doing. So what we're trying to accomplish with light therapy is we're trying to accelerate cellular function. And the way that is accomplished is when you have exposure to that safe spectrum of light for given amounts of time, the mitochondria in the cells get hyperactive. In other words, they start to help the cells function at a much more profound or robust rate, if you will. And so if your cells are going through, say, a restructuring process, then that process will be accelerated when you have been exposed to light therapy for a given amount of time. Now, the effects of light therapy and how long they last vary from person to person. In some people, a session of photobiomodulation can yield several days of feeling more energized, feeling less fatigued, and depending on what the application is for the light therapy, I'll give you an example. Light therapy can be used for things like skin conditions like vitiligo, where your pigmentation is just not there, whether it's a genetic problem or you've lost some pigmentation due to some accident or a burn or something. Well, those cells are undergoing a lot of regenerative processes, and exposing yourself to certain light spectrums can help energize the mitochondria within those skin cells to help bring back some of that melatonin melanum, which is like your skin pigment, if you will. And so it depends on what you're doing as far as the structures are concerned and what your cells are doing depending on which cells you're targeting. So another example would be using a combination of red light with infrared light. And those two combined tend to penetrate pretty deep, well past the epidermis, the dermis, and actually penetrate down as far as the subcutaneous fat layer. So right now, a popular method for, or a popular use for red light combined with infrared is actually weight loss, or actually adipose tissue destruction. And basically, if you apply red light combined with infrared to certain parts of the body that have more adipose tissue, that light, if you expose it to the tissues long enough, anywhere from 20 to 25 minutes, you will accelerate the mitochondria within those fat cells, causing an increased breakdown of the fat cells themselves. And so that could potentially yield a loss of inches, if you want to say it that way. Now, the studies that are out there right now are testing the effectiveness of continued exposure for given amounts of time to red light combined with infrared for the sake of weight loss. But like I mentioned before, there are other applications for light therapy, anywhere from chronic pain, back pain, headaches, visual disturbances, visual loss. Essentially, these light exposures can energize any of the mitochondria anywhere in the body. It just depends on where you're targeting that light. So you can go to a facility that has a device that looks like a tanning bed, but it's actually just a light bed. And this light bed can expose you to any number of lights within the spectrum of safe light. Obviously, you don't want to expose yourself to ultraviolet light because those can cause major burns and can lead to skin cancers. But exposing your tissues to the healthy spectrum of light can yield a lot of different things. So if you happen to be a person that suffers from, say, fibromyalgia or chronic pain, back pain, for example, these light therapies might be beneficial. And I'm a big proponent of using any therapy or treatment that works. So it doesn't matter if it's massage therapy, acupuncture, physical therapy, Chinese medicine, it doesn't really matter to me. So I like to refer my patients for light therapy for certain things like chronic pain, fibromyalgia, and of course, there are a few instances where some patients might want to lose a little bit of extra weight or inches, and the red light combined with infrared tends to be the light of choice for weight loss. So there are many clinics out there that are using red light therapy combined with infrared for weight loss purposes. And from what I've seen, based on the patients that I've sent to have red light therapy done, they have reported to me that they've lost anywhere from a 1/4 inch to maybe 1/2 inch of fat on their waist, which is not too shabby considering it's a very non-invasive treatment. But again, there are many uses for light therapy. And there are studies right now that are testing light therapy on things like autoimmune disorders, like Sjogren's disease, scleroderma, and even to some degree, lupus, if it's affecting the skin. So there's a lot of potential uses for light therapy. Now, what are the unwanted side effects, if any? Well, right now the literature is not super robust as far as what overexposure to these lights might cause. But just based on how light therapy works, in that it's stimulating your mitochondria, making your cells work a little bit more efficiently and potentially working a little bit more than they normally would, the byproducts of that cellular function is obviously going to be picked up in your lymphatic system. And then, of course, it's going to be filtered by your kidneys and your liver. So if you're overexposing yourself to these lights, it's potential that a side effect might be a slight overwhelming of your kidneys and liver for a short period of time. But again, that evidence is just not overwhelmingly strong at this point. So I try to tell my patients, if you're going to use light therapy, keep it to 3 to 5 sessions a week, 20 to 25 minutes per session, depending on if you're doing therapy for your skin to help with lesions or skin wrinkles, or if you're doing therapy around your waist to help you lose fat. Whatever the method or whatever the application is, it's pretty acceptable to do 3 to 5 sessions a week for 20 to 25 minutes. That seems to be a pretty accepted range of time. But there are clinics that do it for far more and some that do it for less. Just depends on what your ultimate end goal is. So hopefully this information was helpful for some of you interested in trying out a new therapy. And it's not that light therapy is new per se, but it is becoming a little bit more common. There are a lot of clinics opening up using light therapy for a multitude of reasons and applications. Hopefully this information was a little bit beneficial for you, and hopefully it just gave you a slightly better understanding of what light therapy is, what it can be used for, how it works, and the potential benefits. So, as always, I appreciate all of you who watch and support the channel. If any of you watching have not subscribed, please do so. It'll help the channel grow. And if you like this content today, please give it a thumbs up or a like, I should say. And then on the next video, I'm going to be getting back into working on the cars. I've actually got quite a bit coming up for both the Bronco and the Mustang, but I'll be starting probably with the Mustang to cover some information there. And then we'll move forward with that. So I appreciate your support, and until next time, this is Motors and Medicine signing off. Thank you.